What is depression? What are the symptoms of depression? What causes depression? What is the treatment of depression? Let's talk about all these topics, very important topics, in a series of videos. I am Dr. Praveen Tripathi. I am a consultant psychiatrist and sexual disorders specialist. We will start with the symptoms of depression. So, how can we identify depression? What are the symptoms of depression? Sometimes people ask that how can we differentiate between depression and the normal sadness, the sadness that happens in day-to-day life? And it's an important question. So the first and the foremost symptom of depression is what we call as depressed mood. The person feels sad. Now, how do we differentiate this sadness from the day-to-day sadness? With the help of two words: pervasive and persistent. The sadness in depression is persistent and pervasive. What is the meaning of persistent? It means that the sadness remains all the time, or at most of the time. The person says he feels sad almost always. Some patients tend to say that when they get up in the morning, they are feeling the worst, and as the day progresses, they tend to feel slightly better, but more or less the sadness is there throughout the day. It is persistent. And it is also pervasive. Pervasive means in all the domains of life, whether the person is going to office, whether he is playing with his kid, whether he is watching a movie, no matter what he is doing, this sadness pervades. It is present in all the domains of life. In fact, some people say that sadness is so intense that it is almost painful. They say that the sadness comes with the quality of pain. So this is how you differentiate the sadness of depression from the day-to-day sadness. The second symptom is lack of interest. People say that they are not able to enjoy anything, and people are able to able to identify the difference between their present and their past. They say, earlier I used to enjoy watching movies, earlier I used to enjoy going for watching a game of cricket, or earlier I used to enjoy listening to music. Now nothing makes me happy. Even if I am scrolling the phone, or even if I am going through the videos, I am just watching them, I don't enjoy them. The lack of interest, lack of enjoyment is a significant and quite visible symptom of depression. The third is guilt. People feel guilty. They blame themselves. They often blame themselves for the depression, and they often blame themselves for the suffering of others also. Such thoughts that I'm causing so much trouble to my family members, I'm causing so much trouble to my wife. They keep on getting these thoughts. They are almost always in a state of guilt. Then lack of energy. People feel tired very easily. They feel fatigued. And they often say that they don't even have enough energy to do the daily chores. Lack of energy. Next is lack of concentration. Patients say that they are not able to concentrate. They say that tasks that they used to complete easily in the past, now they struggle with them. They are not able to read a report. They are not able to focus. And they keep on getting negative thoughts. What we call as negative automatic thoughts. People keep on getting negative thoughts about themselves, such as they'll have thoughts like, I do not have any qualities. I am of no use. Nobody likes me. Such thoughts, such negative thoughts about self. They may also have negative thoughts about the future. They may have thoughts like there is no hope in the future. Nothing will ever change in the future. Things will remain as dark as they are now. And they may also have a sense of helplessness. They may have thoughts like nobody would be able to help me. I cannot get out of this situation. So these negative thoughts are predominant. They are always there. Apart from this, changes in the appetite and sleep. Most of the patients have lack of appetite or loss of appetite, and a large number of them also lose weight. As far as sleep is concerned, different people may have different presentations. Some patients say they are not able to fall asleep. They say they go to the bed, but they are not able to fall asleep. The negative thoughts keep on coming in the mind, but they are not able to drift into sleep. Others say that they are able to go to sleep, but the sleep is broken. They say in the middle of the night sleep breaks, and after that they are not able to go back to the sleep. And then there are third category of people who say that they get up early in the morning. They say usually I used to get up at 8 a.m. but now I get up before 6 a.m. and after getting up I am not able to go back to sleep. So these are the sleep disturbances. Some people tend to sleep excessively, but lack of sleep is much more common. And apart from these, there can be suicidal thoughts. People may have thoughts of self-harm or killing themselves. And if the suicidal thoughts are very frequent and if the person shows clear suicidal intent in the form that he has a plan in his mind, he has decided that he has to kill himself and has a plan, then it is considered as a psychiatric emergency. The patient must be admitted immediately. So all these symptoms need not be present in every single patient, but some of them are present in almost all the patients. And to make a diagnosis of clinical depression, the symptoms must be present for at least 2 weeks. The duration criteria is at least 2 weeks. Alright, so these are the symptoms of depression. In the next video, we will talk about what causes depression.